I'm a young, hardworking mom with 2 fur babies and a 2.5-year-old daughter. I'm Tanya, and I'm a miraculous mama.
Hey everyone, welcome back to Miraculous Mamas. I'm your host, Elizabeth Joy, and I am a certified birth doula and life coach and a podcaster. And I'm so glad that you're here today. We believe in empowering women through education and storytelling. And today we are going to dive into the education side. So for the month of June, we are having a lot of male guests on in honor of Father's Day, and we are a female-centered podcast, but sometimes it's nice to get obviously different experts on and just dads, to hear dads' opinions and stories. We have Jamie, Otis, and Doug. They just had their baby, so Doug's going to be coming on and talking with us very soon, which is super exciting. And Chris Siegfried is going to come on, his wife Desiree. She's been on the podcast before. She's fun. I love following her account. She's such a sweet woman. And we just have some other reality dads coming on and experts. So it's going to be a really fun month. So today we're going to get into oral health. So Dr. Mark is going to be joining us. He's known as Ask the Dentist on Instagram. And I've been following him for quite a while. And I love that he posts just like different facts about like oral hygiene and how it's connected to your whole body. It can good oral hygiene can be indicators of even like heart disease and things like that. He talks about, he gives like different recipes, recommends products, and just really dives into oral care. And we have such a fun conversation today. So we get into all sorts of controversial things. So I want to address that first. But when you think about it, there is a lot of crazy stuff out there. And again, we always say whatever information you learn, you just want to take and move forward. You never want to take and look back and be like, oh, I should have done this. I should have done that. It's just like, okay. Like, do I agree with that? Is that something that I want to apply in my family? Should I do more research into that? Oh, maybe I don't agree with this. So it's good to always question things and to be learning and growing and making improvements, because I know everyone out there just wants to be the best wife, the best mom, the best friend that you can be for the loved ones in your life. So before we get into today's podcast, I want to talk about a couple of things. So we do talk about fluoride, and there is some interesting research that has come out. And I mean, there's back and forth on whether fluoride's good for you or not. It has some benefits for the teeth, but when it's ingested, it could, maybe not be the best. And about 66% of U.S. residents have fluoride in the water, 38% of Canada, but only 3% of Europe. And we kind of dive into a little bit of fluoride, but the study that I'm talking about that came out, whether you think fluoride's good for you or bad for you, I've had this conversation with a lot of different people, but there is a study that talks about fluoride being potentially not great during pregnancy. Fluoride exposure during pregnancy may be associated with adverse effects on children on their intellectual development in utero, indicating the possible need to reduce fluoride intake during pregnancy. I'm going to link the study in the show notes for you guys to take a look at. It's a study that was done in Canada that followed 500, or it was a 601 mother-child pairs recruited from 6 major cities, and they followed the kids for years. So from when the moms were pregnant and then to when the kids were like 3 to 4 years old, and doing some testing and showing that there's potential, effects of exposure to fluoride. So I'm going to link that study for you guys. Also, another thing that I find is super interesting, I'm not like anti-fluoride in your toothpaste or anything like that. Since I've been pregnant, well, actually in general, I don't use fluoride, but, what's interesting though, is if you look at the back of your toothpaste, so look at the toothpaste that you use, look at the back of it, and on there it says, keep out of reach of children under 6 years of age. If more than used for brushing is accidentally swallowed, get medical help or contact poison control right away. So I don't know about you, but for me, it's kind of crazy to think we're putting this thing in our mouth and brushing our teeth. And if my kid accidentally swallows it or puts too much toothpaste on and swallows it, I have to contact poison control. What are these ingredients in here that I need to be worried about? So just take a deeper look into the ingredients that you're using, especially when it comes to things you're putting on your skin or in your body. If you're putting something on your skin or in your body that's saying contact poison control right away, it's like, is this really a product that I want to be using? And is this a product that I want around my kids? Another ingredient in toothpaste that a lot of people often talk about is SLS. So SLS is sodium I can never say it right. It's sodium lauryl sulfate, or there's sodium laureth, which are kind of like two different versions of it. So that is actually an ingredient that's in a lot of cleaning products because it causes things to foam up and things like that. And it might be fine for some people, but for a lot of people, I know someone personally to me who kind of just had reoccurrent canker sores and could not get rid of them. And so I asked, is this ingredient in your toothpaste? And they said yes. And they switched toothpaste, and now it's been months and they have not had a canker sore. Because that is something that SLS can cause. People can experience irritation in their mouth, or they can have allergic reactions. And if you have canker sores or you're prone to them, it can irritate them. It can even cause them. There are some rare side effects with it, but that's also like another ingredient to look into, because it's like a cleaning agent that's in a lot of other things. I mean, it's in shampoos, which a lot of, companies now say like there's no sulfates in it, because people want that foaming effect, right? But there are companies that have I don't know about you. I've tried a lot of natural toothpaste, and some of them I'm like, you feel cleaner when it's foaming up in your mouth, right? You're like, okay, it's doing its job. I've gone down I tried natural deodorants forever. And then finally, I've been using Native for a year and love them. And I've done tons of different toothpaste. And now there's probably 3 brands that I really, really love. One of them, I do use Native. Hello, that brand is really good. And there's one other one that I can't think of the name of right now. But that's just another ingredient that, just do some research on for yourself. Look into it. Why is this in my toothpaste? Why is it also in other cleaning agents in my house? And things like that. So we definitely go into some weird places, but I like weird, so but it's a fun podcast. We didn't get to dive in as deep into some of the topics that I would have loved to. One crazy thing happened after I had recorded with him. So I cracked a tooth, which was pretty crazy, and I had to go to the dentist, but luckily they didn't have to put me under. I mean, normally I'd be like, just knock me out because I hate going to the dentist. But he was like, since you're pregnant, all this, I just had to have a tiny bit of lidocaine right where that tooth was for them to be able to work on it. It was honestly probably the best dentist experience I've ever had. He was so gentle and nice, and I felt so comfortable. I was honestly really scared going in. I called Vito. I'm going to start crying right now. But I didn't. I'm really proud of myself. But weird things happen during pregnancy. They say you lose a tooth for every kid. But, oral health is one of those things, which I didn't do. So I worked on getting my health in check before Vito and I started trying. I didn't necessarily work on getting my oral health in check. I know the mouth and the body are connected, but Dr. Mark talks about that too, because your mouth tells you so much about your health. And if you guys are interested, I can leave some more information. I got into oral health, just learning about it almost 10 years ago from a guy named Sean Croxton. And he did an oral health summit. And I know Dr. Weston A. Price is one of the people that you guys can look into, and a lot of his work and research is all over about whole body health with the mouth. He studied cultures and people with the best oral health, what their diets were, what the rest of their health in their body was like. And he kind of was the catalyst for change in oral health and more specifically holistic oral health. So I am super excited to get him on. I know we're going to talk about a lot of different things, but if you just go to his Instagram, Ask the Dentist, or to his website, he has tons and tons and tons of information. So I'm constantly looking at it because he'll be like, what is your tongue telling you? And then I'm like, oh my gosh, what is my tongue telling me? And then I look at it and I'm like, wait, is this something that is happening in my body? Because it can tell you if you need more vitamins, crazy, crazy things. So he's a lot of fun to follow. And I'm super excited for you guys to be a part of this conversation. All right, I'm going to grab Dr. Mark. All right, everybody, I have Dr. Mark Burhenne here, and I'm so excited to talk to him. We have never had a dentist on the podcast before, and I've been following his Instagram page, Ask the Dentist, for a while because he always has a bunch of amazing tips up there. He's a functional dentist and the co-founder of Ask the Dentist. So thank you so much for being on, Dr. Mark.
Thanks for having me on the show, Liz. And it's about time you had a dentist on your show.
I know.
We have a lot to offer, and it's not just about teeth. But we'll get into that.
Yeah, well, I'd love for you just to kind of tell the listeners who you are and what exactly you do.
So I've just been a practicing dentist for 35 years, and that has slowly evolved over time. But I love the functional approach, looking for root causes. About 15 years ago, it occurred to me, there wasn't one moment, of course, but that dentistry is way more than just teeth and gums and saliva and spit. I mean, the connection between, the whole body systemically and oral health is just phenomenally complex and intricate and so important to include in overall health. Whether it's your physician or your dentist, it's important to see the whole picture for what it is. So I've been practicing in that way for quite a while now. And for example, 34 years ago, when I became a dentist, my daughter was born, who's also co-founder of our website, Ask the Dentist. And, for example, I at that moment, it was literally weeks before she was born, I went out and bought a distiller after doing some research on how to get fluoride out of her drinking water, our drinking water. And so these are things that I decided on, and we can talk about why back then, because certainly now we know more about it. But from my University of British Columbia days in college, biochemistry degree and art degree, I've always been interested in health sciences, food, nutrition, longevity. I read, fantastic books back then. I'm dating myself by Dirk Pearson, Sandy Shaw, Friedhof Capra, The Turning Point. So it's always been kind of a very focal point of my personal life: vitamins, supplements, exercise. And of course, back then, a lot of it we got wrong. So it's been a long journey, and I love just talking about health and of course, educating people, patients. And that's really what I think the role of a doctor, the first and most important role is not healing necessarily, but educating and then healing.
Yeah.
And of course, that's where the Latin root of the word doctor comes from. It's to teach. So,
yeah, but I feel like, so for the most part, anytime I've gone to the dentist, I've never learned anything about the rest of my health until recently. So it's so crazy how it is connected, but it's just also confusing that why are we not being told that? Like going into the dentist, it's like, oh, you have a cavity, we can feel it. You have this going on, we can do that. Instead of being like,
okay, there's a underlying issue in your health that we need to address, because that's also going to help your oral health, because that's one thing. Your oral health tells you so much about the rest of what's going on with your body, and it's such a missing piece. So it's kind of like confusing when most people have never heard of this. And it's like, how come I haven't been told about this? Why is my dentist not telling me this?
Right. A lot of it is because of the curriculum. It is very difficult to educate a dentist in 3 or 4 years, which is the typical time that it takes to educate a dentist, not including a general residency program. But I've contacted many dental schools and asked them, to include more or teach them more about sleep and preventative care and the oral systemic connection, oral microbiome. These are all things that dentists have to get after school. The answer is always the same. There's just no room in the curriculum anymore. And I understand that. You have to teach that dentist to become a surgeon, a mouth surgeon, and it's a very limited period of time. So the curriculum is full, it's packed, and there's, they can introduce the concept, but they can't really get into it. So that's all comes after dental school. That's why continuing education is so important.
Yeah, for sure. So I'm going to just kind of dive right in. For those of you guys listening, we're going to talk about kids. We're going to talk about pregnancy. We're going to talk about, just when you're talking right now, I wrote down a bunch of other notes of things that, so it'll be a fun conversation. But so I was one of those kids who had tons of cavities. I always got cavities, and you hear it's genetic. I'm sure, you'll have to tell me that can play a role, but there's still things that you can't just be like, oh, it's genetic, there's nothing I can do, and not be proactive. So is there a factor in genetics when it comes to teeth?
Absolutely. Genetics, there is a genetic predisposition to getting a cavity, but I have a list, and it's 4 items, the things that are going to cause cavities if you don't address them, and it is number 4. And you can also throw in epigenetics in that as well. So it definitely is. Some people, as the enamel organ is creating the tooth in the gum, actually it's in the jawbone, that those folds of enamel and the enamel formation, dentin formation, they form lobes, and those lobes, when they come together, they can come together in a very shallow groove or a very deep invaginated groove. So when the tooth erupts, if you have a very deeply invaginated groove and you're eating, and here are the other 3 top reasons, if you're eating a very high carbohydrate diet, then those grooves, once they get the bacteria in there and they're being fed the right carbs, then the acid attacks and the decay process, now called demineralization is the correct term, and remineralization is not as active as it should be to counteract the demineralization. Essentially, you're getting a cavity that you have no access to with mouthwash, toothpaste, toothbrushes, floss. And that's why some people get more cavities than others. But the good news is that we have control over our genetic destiny and certainly our environment, the epigenetics. And if you eat well and brush well, biofilm management, and if you keep the pH in your mouth steady, we can talk more about that. That's the oral microbiome, keeping that pH very constant, then all these dysfunctional, dysbiotic things that cause cavities won't happen, whether or not you have, teeth that are genetically, predisposed to getting cavities or not.
Right. So there's always something that you can do.
Right.
And I always think too, sometimes when they're like, oh, it's genetic, it's also because lifestyle and habits are passed on as well. It's like you kind of eat the way your parents ate, and then you kind of adapt those habits and carry that on. And that plays a big role in a lot of that stuff too.
This episode is sponsored by BetterHelp. Is there something that is interfering with your happiness? Something that's preventing you from achieving your goals? It is okay to get help. BetterHelp will assess your needs and match you with your own licensed professional therapist. You get to connect in a safe and private online environment that is convenient for you. You can start communicating in under 24 hours. It's not self-help, it is professional counseling. You can send a message to your counselor anytime. You'll get timely and thoughtful responses. Plus, you can schedule weekly video or phone sessions, whatever you are comfortable with. And I love that people are having this conversation now, breaking the stigma around mental health, because you guys know I'm such an advocate for getting counseling. And I think it's important to have these conversations and be able to say that, oh yeah, I talked to somebody, or I know for me, like I've been to counseling a few times and I'm currently using BetterHelp for some stuff in my life. And it is really nice just to get someone who's outside of your circumstances, who has studied how to like best help you and to be there for you through whatever you're going through, whether you're dealing with stress, depression, anxiety, relationship problems, sleeping, anger, family conflicts, grief. Anything that you share is going to be confidential, and they're so professional. This is my second time using BetterHelp, and I absolutely love them and highly, highly recommend their services. I would love for you to start living a happier life today. As a listener, you can get 10% off your first month by visiting betterhelp.com/mamas. Join over 800,000 people taking charge of their mental health and at betterhelp.com/mamas. That's HELP, betterhelp.com/mamas. Now back to the episode.
So let's talk about, you mentioned the pH and your oral microbiome. So I just got a tongue scraper. Is that something that I should be using or no?
Absolutely. I mean,
Okay.
Tongue scraping is great. Takes a while to get used to. We can talk about all the specifics and how to do it if you want. But let's face it, if you were perfectly healthy, in other words, you had the perfect oral microbiome, your biofilm was the right thickness, it had the right combination of bugs in it, and it was pulling all the perfect ingredients in your saliva, like phosphorus, calcium, other ingredients that are building blocks of enamel, and we're passing it through and remineralizing your teeth, and there was no demineralization going on, or at least remineralization was more efficient than the demineralization. Your diet was perfect. Your mouth was moist. You didn't keep your mouth open too much, which is what dries out the mouth, which lowers the pH. Now, I'm painting a picture here that very few of us actually are able to attain in today's society. But if that's the case, then you probably don't need to scrape your tongue. But if any of that's happening, then you've got colonies of bacteria. And this is one of the niche areas of the oral microbiome. There's several niches, and each niche has a different kind of ratio of bugs. And then sometimes it's good to disrupt that. That's what brushing is. It's a disrupting of something that is not forming correctly because you're feeding it perhaps the wrong foods. And maybe like the strep mutans bug, which is the big bug that is, it's not the only bug, but it's the big one that's always mentioned with formation of cavities, that becomes dominant. And that's not what you want. You want everything to just, it's this little colony. It's a organism in your mouth that is living inside of you, and that has to be working in harmony. So sometimes, and most often, obviously, flossing and brushing and scraping your tongue is important. I mean, I see a lot of patients and they've got yellow tongues, brown tongues, they have white tongues, they've got a yeast infection in their tongue. The tongue is like a shag carpet. And again, I'm dating myself, but if you don't know what a shag carpet is, that was big in the 70s. It was this really long pile carpet that you had to use a rake to clean.
Oh my gosh.
It was in vogue back then, but it would just collect all sorts of stuff because, think of the tongue. This is not an exaggeration, but think of the tongue as a field of mushrooms. And of course, the mushrooms have these little heads on them, and there's all these little nooks and crannies underneath it that you can get a lot of junk caught in there. Food, debris, yeast cells, protozoa, viruses, bugs. So sometimes it's good. And again, you have to talk to your dentist to find out if you should be a tongue scraper. It's good to clean that and disrupt it and give it a fresh start.
Yeah. Yeah. That's super interesting. So I'm going to dive into pregnancy and kids, and then I'd love to come back to fluoride. So I'm an avid brusher and flosser. I feel like I get if I don't if I forgot to floss my teeth, I'm like that person that I'm like, I can't go to bed without flossing my teeth. So I floss just before I go to bed.
We love people like you, Liz.
Thank you. Yes.
We love it. Yeah.
I love to brush and floss. I try to do coconut oil pulling like once a week. I don't know if that's enough to even do anything. And we can talk about the benefits of that. But I'm since I've been flossing forever, my teeth don't bleed or anything like that. But since I've been pregnant, I was just brushing my teeth the other day and I started to bleed. And like when I floss now, I bleed. And why does that start to happen during pregnancy?
That's a really good question. I'm glad you brought that up. So my let's see, there's perinatal, postnasal, my prenatal advice would be, of course, before you conceive, make sure that your gums are healthy, that there's no sign of gingivitis even, or any form of gum disease. And we can talk about why that is. But so obviously that's you. You came into your pregnancy with healthy gums, but during pregnancy, the hormones change, progesterone, estrogen levels change. That's part of the pregnancy process. It's necessary for the baby to thrive. And that will cause some inflammation, and inflammation will cause some bleeding upon provocation, we call it. And that would be flossing. It would be going to the dentist to have a cleaning, and that's normal. And then your dentist really has to discern between what's normal and what's not. So I wouldn't worry about that. But let's say you were someone that had some periodontal therapy, over the years, then, is that an issue? Because if you do have gum disease and you're pregnant or before being pregnant, that can lead to low birth weights, early term births. There is a connection there, and that is, of course, important to know. So here's another thing is that pretty much when a woman comes in that is still able to menstruate premenopausal, most dentists can pick up, and it's in a very specific area. I don't know why that is, but we can see the little edematous changes in the gum tissue. It's usually about a week before the period, and I'll make a note of it. And it's nice because the patient's appreciative because they go, okay, this guy's on it, he knows. And so that's important to note that you also will get that same thing, during what's the period when you're very able to get pregnant? There's a term for that.
Ovulating, when you're ovulating?
Thank you. During ovulation. So again, those are the female hormones that are doing their job. And one of the ways of knowing that is that change, that hormonal change, and it exhibits itself as a slight inflammation of the free margin of the gum line. And it's visible to dentists if we're discerning and looking for it. So
my mind is blowing right now because I feel like so basically it's like you hear all the information, you get pregnant. Oh, okay. So start taking a prenatal. Oh, you get pregnant. Okay. Start doing this. I remember reading in like all my pregnancy apps, now's a good time to schedule. A lot of them say now's a good time to schedule an appointment with your dentist. Because a lot of things can happen during pregnancy just to get a good cleaning. But nowhere have I read, like, go to the dentist before you get pregnant and before you start trying, and just make sure that your oral health is good.
Yes. Some of the best advice that any physician or dentist or any healthcare provider can give is to make sure that you have a clean bill of health in terms of oral health. And I would recommend this years before, because there's a lot of advice that a dentist and a physician can give in terms of the correct prenatal. Prenatal should be taken before conception. I even give advice to husbands to be, in terms of sleep. If you're not sleeping well, the sperm is going to have some issues. Before you think of conceiving, nail down your oral health. Very, very important.
Could oral health potentially affect fertility?
Yes, definitely. That's very interesting you brought that up. There are connections between fertility and oral health. Men that have gum disease have some issues in that regard.
Wow, yes. That's so crazy.
There are studies that support that.
Yeah, wow. I feel like I'm learning so much more recently, too, about the men's role. Because I feel like for years, all the weight's been put on the woman. And now they're
Right.
like, no, sperm health is so important. And there's so much that goes into that. So it's cool
That's
learning
not
all
fair.
this.
It's not fair. And the only blame we've ever gotten in the past was the sex of the baby, but it goes well beyond that. Of
Right.
course, it takes both partners have to be extremely healthy for optimal results. And that starts before conception.
Right. Wow. That's so interesting.
I'm going to take a quick break to ask you guys, how many of you have a sweet tooth out there? I know we're talking about teeth a lot in this episode, but what if I could tell you that you could have something that curbs your sweet tooth but is good for you, packed with superfoods like turmeric, MCT oil, coconut, Himalayan sea salt, cinnamon, and black pepper, and it is delicious chocolate, and that is cacao bliss. It is so good. It's the perfect way to fuel your body with healing nutrients that keep you healthy and energized. Nothing feels better than being able to enjoy some guilty-free chocolate. I absolutely love it. I've actually been using it for some baked goods. Vito has a huge sweet tooth with chocolate. I've been using it for baked goods, but also just in a nice warm cup of cacao. Oh, I love it with a little bit of honey and macadamia milk. That is my go-to nightcap. Fall in love with a truly decadent, healthy, guilt-free chocolate. Remove your cravings and help keep your body trim and energized. Reduce inflammation with one simple drink. Cacao Bliss is your drink. It is friendly to paleo, gluten-free, keto, vegan, and vegetarian diets. And right now, Cacao Bliss is offering up to 46% off and a free electric frother when you use code MAMAS at earthechofoods.com/miraculous -mamas. That's up to 46% off and a free electric frother when you use code MAMAS at earthechofoods.com/miraculous -mamas. Now back to the episode.
So now let's say I have my kid. When do you take your kid to the dentist? Because they start getting teeth. I honestly don't even know at what age. And like, when do you start brushing them? When are you supposed to take them? I don't know any of that information.
These are questions we get all the time on our website. They're great questions. There's a lot of confusion, unfortunately. It depends on who you talk to. Let me give you, dentistry, if you're a pediatric dentistry, they say at age 1, because there's some advice that they can give in terms of breastfeeding and preventing breastfeeding, bottle feeding caries and all that. A lot of dentists will say age 3. Those are the ones that really can't handle the younger kid. We always joke in dentistry that seeing a kid is community service because they're difficult and all that. But I think, I prefer to have a relationship with the mom and dad before conception. They're getting advice from me that whenever your next cleaning is, bring in your infant. It could be 6 weeks after your birth. It could be later. Certainly it depends, but it's important that they continue keeping their dental visits. And that's difficult to do sometimes after the baby's born. I remember with our first daughter, we were like two zombies walking past each other. One of us was holding the baby, right? Mm-hmm. But that's important. And we're not necessarily seeing, the child, the infant at that point in time, although it depends. Sometimes parents will come in when the infant is maybe 8 or 9 months and it's important. There are many factors here. The child will see the parent coming in, and at some point that becomes integrated into their thinking. My favorite way to get a child in the chair is to have them sit in the chair. They're maybe 2 years old, maybe a year and a half. They see mom or dad in the chair, and then they're like, well, it's my turn. I want to try that. That's my favorite inroads into getting the child in the chair, handing them a dental mirror, having them put gloves on, getting them used to the process. I kind of didn't like my dentist as a kid. I have a lot of patients that are very fearful. They're adults, and they can all remember that first horrific, stress-inducing moment, and that really kind of imprints upon you and makes you a not in a bad way, but just a poor patient because you are going to see the dentist, and that's the last thing we want to create. So I would say, the key there is that we may not see your 4 month, but at least we can give you advice, based on what we see with you. If it's mom or dad, like, how's breastfeeding going? Is there a tongue tie? I actually recommend that you have a specialist come in at the moment of birth. In other words, baby's born, make the phone call. Maybe a family member can make that phone call. Bring in the specialist, because a lot of hospitals miss the tongue ties. And then to make sure that's not an issue, because in those first few moments, it's maybe hours. If the baby can't latch on, things start going south very quickly in terms of nutrition, the baby learning how to latch on, facial development, postpartum depression. I mean, mastitis, painful breastfeeding, all those things. So in seeing a dentist, whether or not it's you've had a baby or not. I mean, seeing them before, seeing them during. Just keep your regular dental visits and bring in your baby. And there's so many advantages to that. You're going to get advice on breastfeeding. You're going to be able to have someone look at it for a tongue tie. And, it's just good to talk to a professional about all of this. It's important. So just keep your regular appointments. And if you have a baby, bring them in.
Yeah. I can be honest. I haven't been the most loyal dentist patient. But I also had a super traumatic experience when I was little. And I just remember my dentist saying, Elizabeth, you have to stop screaming. You're scaring the other patients. And I remember being terrified. And I don't remember much else from the appointment, but I just remember him telling me that. And I was probably 5 years old. So I'm like, I don't like the way dentist office smell. I don't like, all of it.
It's hard to undo all that, once you have that notion. So
yeah, for sure. So bring your kids in, but when, I guess, at home do I start brushing their teeth?
Brushing. Yeah. Good question. There are all these choices now with toothbrushes, and a lot of parents will come at their 6-month-old that's just teething with an electric toothbrush, and that can scare the heck out of the kid, right? I mean, and then of course you've heard the gauze method where you take a gauze and you just kind of pinch the teeth with the gauze, and I'm not very keen on that. First of all, start brushing. Anytime you and your partner brushes, make sure you're brushing in front of your kid. That is a form of brainwashing. Sit there. You don't put in fact, don't use toothpaste, because that complicates it. Then they'll want the toothpaste, and that's a whole different issue. But take a brush, a manual toothbrush, and just sit there and massage your gums and teeth for like 4 or 5 minutes in front of your child. And at some point, they will think that's a normal thing. So if you just introduce a toothbrush right away, that can be very traumatic, because remember, this is your airway, especially if they're just mouth breathing, can't breathe through their nose. If you get close to their airway, block it, if it's a big piece of food that they can't swallow, they will go into panic mode. And every time that happens, it just builds that experience is ingrained in, that's not what I want in my mouth. So if you have a problem kid that doesn't like to have their teeth brushed, consider tongue tie, consider the fact that they maybe cannot breathe through their nose, observe them at night while they're sleeping. Is their mouth open or closed? A lot of those phobic kids that don't do well at the dentist, that don't do well with parents trying to brush their teeth, they are protecting their sole form of breathing. If you can breathe through your nose, then it's easier to have things in your mouth. So I would pick there are all these great little toothbrushes. I can't think of the name now, but we have an affiliate store on our website that has these wonderful little big handled, tiny little toothbrush head type of Obus comes to mind, but that could be wrong, that they can pick up and use. And I think it's best that they try and do it on their own, even though they're going to do a lousy job. It doesn't matter. Make sure it's their idea. You're not forcing the issue. And remember, if they're eating well, you don't really have to panic when that tooth comes in and start brushing it right away. You can even introduce the toothbrush before they have teeth. But make sure you are brushing. Every time you pick up a toothbrush to brush your teeth, make sure it's in front of your kid.
Mm-hmm. If you're looking for a fun way to pass the time while engaging your brain and enjoying breathtaking visuals and a gripping story, your answer is Best Fiends. You get to collect all of these fun, cute characters while solving puzzles. And these characters come with different strengths and abilities. You get to evolve them. And when you pass levels, you gain keys to unlock more
diamonds and life and all these other fun tools that you get to use in the game. It is casual and anyone can play it, but it is mostly made for adults. You can spend as much time or as little time in the game as you would like. I am officially in the 200s, the late 200s on it, and it's been a lot of fun. I sometimes play until I run out of life, and then it's nice because you can connect with family or friends on there, and they can send you gifts and things like that. And they're always changing the landscape. I like the ones that have like the little ticking time bombs in it. Those are my favorite levels. But I definitely stay interested in the game because I feel like it is working my mind. It just kind of is a break away from everything, and it is so much fun. Most of the characters are bugs, but and you fight against these slugs, and it's a lot of fun. I get into it a little bit, but it's a unique and exciting puzzle experience, unlike any other puzzle games out there. They update the game monthly with new levels and events, so it never gets old. If you find yourself just like having some downtime, definitely download Best Fiends because it is a great way to pass the time. I find myself doing it when I want to unwind or just kind of take a break from work and just kind of play for a little bit. And it is a lot of fun. You can engage your brain with fun puzzles and collect tons of cute characters. Trust me, with over 100 million downloads, this 5-star rated mobile puzzle game is a must play. Download Best Fiends free on the Apple App Store or Google Play. That's Best Friends without the R, Best Fiends. Now, back to the episode. So recently I had my husband and I went to go get our eyes checked, and we were just asking him, like, what issues are you seeing today that maybe you didn't see before? And he was saying younger kids are developing more nearsighted vision because they're no longer using their distance because they're staring at things right in front of them. And he's seeing their eyes deteriorate quicker than their parents.
Yes.
And I'm like, oh my gosh, that is so crazy. And I'm just curious, like, I'd like to hear the dentistry side of it. Like, what are you seeing now in kids that may have been different from their parents? And what are some of the biggest, I guess, problems that you're seeing?
Yeah, that's a great question. I've never been asked it in that way. And I think a lot of it is because of screen time. I mean, focusing closely and the blue light and all that. Yeah. So there are things in dental that are similar. And a lot of that most of it is epigenetic. It can be lack of breastfeeding because women are in the workforce. No pressure on women. That's not their fault. It can be allergies. This sterile world that we live in. So they have allergies. They can't breathe through their nose. Breathing through your mouth will make your face develop in a different way. We're seeing a lot more narrow, deficient jaws, narrow faces. I always fall back to, it's hard to describe, but there are 3 boxes. As the child develops up until age 10, there's a mouth box, an airway box, and a nose box. If the mouth box and the nose box don't get to their full width and grow properly, which all comes from muscular movement of the tongue. So if your tongue is tied or you're breathing through your mouth, the muscular actions of chewing, swallowing, talking, all of that swallowing won't work properly. So those 2 boxes are small. That means your airway box will not grow to its full potential, which leads to a lifetime of dealing with sleep apnea. So there are things in, like your example with the ophthalmologist, there are external factors that are affecting our dental development. I mean, and if you have a small mouth box, then of course when the teeth come in, same number of teeth come in, typically, there's just no room for them. So then you get crowding. So then you go see the orthodontist when you're 11 or 12, which I would argue it should happen sooner. And then some teeth come out and then the mouth stays small, but they just took out teeth to fix the crowding. So there are similar things in dentistry, like what you mentioned with eyesight and all that. And it is a problem. It is our modern day world.
Mm-hmm. So I guess what can parents do to prevent those things?
Right. Well, breastfeeding is very important. That is the vitamin K2 and minerals before you conceive and during, perinatally speaking, you got to take the right vitamins. I mean, all these building blocks have to be on board. Calcium is important, but calcium alone is not enough because K2, which comes from grass-fed, sources like butter and fermented beans and meats and grass-finished products, pate, that kind of thing. All those things are that's another epigenetic factor. They're deficient in our diet. So vitamin D will get the calcium past the gut lining, but once it's in the bloodstream, K2 is able to better put the calcium into all the right body parts. Obviously bone structure, facial structure, lower jaw, upper jaw. So that's something that is important. I mean, the action of breastfeeding, it's not just about the content or nutrients in breast milk. That's very important, and that's where all the focus is. It's the motion and action of breastfeeding that helps develop the face. So that's important. A lot of moms and dads, they find it very difficult to breastfeed. A lot of that is because of a tongue tie, which is a very common midline defect, and that goes back to nutrition. Depends on whether you have the MTHFR gene or not, but we've been told to take folic acid, the B12, the B9 is very important. B9 is the most important for preventing these midline defects, but a lot of mothers that have this gene can't absorb it, and we've been telling everyone to take the wrong form of it. That's the synthetic form. That's why the folic acid, methylated B vitamins, those are important as well, and that if it prevents the tongue tie gene, then breastfeeding goes better, and that's important for the development of the child. Also, diet. I mean, you really got to focus on diet. That is one of the top two reasons for decay and oral health issues, and so there are a lot of things to consider, and so it's very important to get advice, before you get pregnant, while you're pregnant, and certainly afterwards. And all this development occurs up until age 10, 11. The last bit of advice I would give is make sure you get an orthodontic consult or referral by age 5, sometimes earlier. If your child has swollen tonsils and adenoids and can't breathe properly and is whipping around in bed while they're sleeping and they're a little inattentive during the day, I mean, they're not sleeping well. There are a lot of sleep issues that children are dealing with, sleep disorder, breathing, and things like that. So you have to get a good referral to pediatric ear, nose, and throat. And there are not a lot that get that this will affect their development. And there are not a lot of orthodontists that will treat someone at age 5 or 6 or 7. My youngest was treated at age 5. A lot of orthodontists will wait. So it's a very complicated thing, raising a child. I mean, as everyone knows, right? Not easy. So there are a lot of, and again, all this is on our website. It's in my book on sleep. I mean, it's all there. So not to worry, but it's important. There are a lot of factors that will affect the development of your child, dental factors.
Right. And I feel like you don't really feel like dental factors are going to affect your child's sleep and their development and everything like that. So just kind of absorbing all of this information, it's like, holy cow. But so much of it goes back to, it starts with our health, right? And the things that we're doing. So it is super important to try to prepare your body for conception and for pregnancy and things like that to make sure that you are getting nutrient-dense sources of things. So you had talked about calcium, and I just kind of want to come back to that because that's one of the biggest things that you hear for kids is just they need calcium. They need calcium for strong teeth and bones. And the number one recommended source is cow's milk. And I'd love to just kind of hear your opinion or expertise on it.
I mean, calcium's important. And as I said earlier, you need D3, you need K2, you need a little A for all that whole calcium process of building strong bones to occur. The source of calcium, I mean, that's a tough one. The good news is that you don't need cow milk to do it. cows make me a little nervous. The way, unless it's very high quality, hormone free grass fed milk.
Right.
People that'll tell you to drink raw milk, that has some cons, of course, potentially, but most people just focus on the calcium, and you've heard a lot of moms say, and there's the old wives' tale that mom gets a lot of cavities because the calcium's coming from the mom, and that's not true. That is a myth. So I think, perinatally speaking, if the mom's diet is optimal, lots of leafy greens and a paleo diet, and they're drinking milk or eating cheese, that kind of thing, and staying away from carbs, that as long as there's vitamin K2 on board, in other words, if you aren't eating that way, supplement with that. And if the mom is eating well, then I think that's the only thing you have to be concerned about in terms of calcium. Of course, when the baby's born, it's added to formula, but formula is not ideal. Breast milk is fine for that kind of thing. Breast milk is an amazing nutrient, probably one of the most sophisticated, complete packages of food in the world. But then afterwards, what do they drink? So I'm not against drinking milk as long as it's a very high quality source of milk, which is readily available these days in the U.S. But goat milk is fine. Some people don't like it. You can certainly take calcium supplements, and calcium comes in many different forms. I wouldn't do orange juice fortified with calcium. I think that's a mistake. There are even some dentists that think that milk, the calcium in milk, makes a great toothpaste. So it's a good form of calcium. But calcium comes from leafy green vegetables and a lot of different sources. So I wouldn't necessarily load up on the milk, especially if your child is allergic. And if your child is running around with a stuffy nose and runny nose and can't breathe through their nose, then the first thing I would look at is dairy products. Make sure you can breathe properly and look for other sources of calcium.
Yeah. So you had said paleo diet and no carbs.
Mm-hmm.
I just feel like I'm not a happy person when I don't eat carbs. I try to eat pretty clean. Right. But why the no carbs?
Well, our bodies evolved to many things. And, a few hundred years ago, carbs came on the scene, and our bodies still don't do well with that. We haven't adjusted to it. Not that we ever will, but it's the insulin system in our body is designed to keep that blood sugar spike from occurring in case we come across something like that. But it turns out that every time we have a snack, that emergency system of keeping our blood stable is in use. And that's where this insulin resistance comes from. We can only do that for so long until we become very, very used to eating carbs, but with all the side effects. So, other than carbs causing cavities, we've talked about that. It's just hard on blood sugar levels. It's very difficult especially for kids. That's not a normal diet. If you think of it as in the ancestral point of view, that's not something our bodies are meant to see unless there's some reason, we were exposed to a lot of it in our ancestral lives. But today, it's the norm. And that over time will lead to problems. And you said you're not happy with it. I hear that all the time. That was me. That's how I got through dental school. It wasn't Ritalin or coffee or caffeine. It was baked goods. And so I was addicted to sugar. And if you like your carbs and you take it away, yes, you will not be happy. And there is a withdrawal period. And I would recommend everyone, if they can, become fat adapted, including your kids. And I've seen parents do that where if there's no such thing as low blood sugar, if you're fat adapted, because I've seen my kids do this where they go without meals for a day and they don't get really upset or fidgety or grumpy or upset. And that takes time. But that means eating a lot of saturated fats and protein, bacon and for animals and this and that. And that's not for everyone. For a variety of reasons. So, but be careful with carbs. And of course, there are good carbs and there are better carbs, but carbs in general, you should limit those. And it'll even help your pregnancy. it'll stabilize blood sugar levels. It's a mismatched disease. Again, our bodies just weren't used to seeing all that sugar and glucose, and we just never, our system isn't geared towards dealing with that well. And unfortunately, it's here now, and it seems to be the norm. And that's one of the big drivers of chronic inflammation and disease in society.
Just to clarify, though, when you say carbs, you're talking about grains and things like that. Like, 'cause obviously, like fruits and vegetables are considered carbs as well, a form of carb, but it's more just kind of the grain, pastas, breads, rice.
A potato is worse than like a sweet potato. For me, a saltine cracker is one of the biggest drivers of decay.
So interesting.
And it's not necessarily a candy. I mean, Mark Hyman, a very well-known functional physician, will tell you that bread is worse than sugar. And I would agree with you. It depends on the bread. I mean, we're talking about Wonder Bread and even whole wheat bread. I mean, it's a very highly processed carbohydrate that when the bacteria see it, they can break it down very quickly and create all their havoc. If you give them a very complex carbohydrate or no carbohydrates at all, you're not going to get that reaction. You're not going to get the spike in insulin. Someone once told me that the key to longevity and happiness is to produce as little insulin as possible in your life. And I think that's very simplistic, but there's something to be said for that. We're doing that every single day. I used to be a big snacker. I wouldn't eat a lot. My way of getting through the day was just to snack on something every 2 hours and eat, including eating breakfast. And that does not work. That leads to weight gain and to brain fog. And it's better, if you can skip a meal, you're doing well. You've got a good diet. If you try and skip a meal and your blood sugar level crashes and you feel grumpy and upset and all that, then you need to change your diet. You need to change your behavior in terms of eating.
Yeah, that's so interesting. So I'd love to go into fluoride quick, because I feel like that's kind of a controversial thing. Like, I've refused fluoride treatments at dentists before and kind of gotten a little attitude. And it's, I guess I'll have you explain it better, but fluoride is a naturally occurring mineral that's in a lot of things, but what they're using is an artificial that is way too concentrated and basically not even really beneficial for us.
Right. The form of fluoride that gets into your water supply is a byproduct of the phosphorus fertilizer industry. And of course, a lot of the conspiracists will say that, it's designed that way because they can sell it to a municipal water supply. And some will say it's a communist plot that was very popular back in the 60s. The good news is that the science is coming out. The U.S. is the number one fluoridator of water supply in the world. I think a lot of people assume all other civilized countries do it, and that's not true. There are 3 studies out now that it lowers the IQ of your child. There's some controversy as to the way the studies were done. There is a lawsuit coming now by the Fluoride Action Network, which is a group of very educated physicians, PhDs, and dentists against the EPA. It's coming to San Francisco. I hope to actually be there. Back when my kids were born, the city of Sunnyvale, which is where I work, about 5-6 years later, they had a meeting because Sunnyvale has a very fragmented water supply and there was no fluoride in the water. And it was mandated in the state of California at some point that cities had to catch up. And so I went to the meeting and discussed it. And I remember standing up and saying some things. And I had raised 3 daughters, or was raising 3 daughters without fluoride at that point. And they have no cavities. And, there are other reasons. I was trying to explain to them really what the discussion should be. And I was literally silenced and threatened by a group of men in very nice business suits with briefcases afterwards. It really is. It's corporate influence for sure. And there's a lot of misinformation, and I think it has yet to be played out. But my advice, and again, this is what I did, is I would have the whole family drink distilled water. And second best would be using a reverse osmosis unit, but get the fluoride out of your water. And even recently, I think it's the CDC, they lowered the amount of fluoride that was being added to the water because we were adding too much. Again, when there is a state of lack of knowledge, I always revert back to what's safest. And before all this knowledge was available, I just had a bad feeling about fluoride. It made me nervous. And so I basically went out and bought a distiller before Catherine was born, and they were all raised on a distilled water. Of course, we added minerals to their diet, and that worked fine. So yes, in a society that is eating a lot of junk food, again, that comes from big corporations. There are about 4 or 5 of them that basically make all our food, like Cheerios, that's considered to be a healthy product. It's not. Cereals, a lot of corn products. I mean, these are big mega corporations that are determining what we eat. And that is what's driving disease. And one of those diseases is decay. Mm-hmm. But then our Band-Aid is let's add fluoride to the water, another potential toxin. So that kind of thinking just never worked for me. And as I said earlier, I was very much into root causes, even as a teenager, and always questioning, the conventional wisdom when it came to health. My father was a physician. He actually was very much for saturated fat when we were against saturated fat. And of course, if you read about that now, that was a big hoax. That was based on research that was wrong. And it was the carbohydrate industry, very happy about that, saying that carbohydrates are really what you need for brain health and for thinking. And now we know that's all wrong. So do your searches on the internet. Don't use Google, of course, because they're making the decision for you on what you read, and really learn how big corporations have influenced what we eat, and that has led to a lot of disease. So another good source I would recommend, just recently I became aware of it and read it, is Mark Hyman's new book on food fix. And that explains a lot of it, including global warming and how the big food corporations are one of the largest contributors
100%.
to global warming. Mm-hmm. And lack of minerals in our diet. And so there's a lot of misinformation out there. And so the diet is extremely important.
Yeah. I mean, I could talk about that stuff all day when it comes to just even we're not getting the same nutrients because of the conditions of our soil. Like even the vegetables we eat aren't as nutrient dense as they used to be. And right. I mean, most of the corn grown in America is to feed the factory farming industry, which if those crops were grown, they could actually cure world hunger.
Exactly.
It's so crazy. It's mind blowing. Yeah. I could talk about that stuff all day long.
And then food subsidies, the food stamps program, the number one beneficiary of that is the company Coca-Cola, and it's based on one product only. It's their Coca-Cola drink. I mean, I think it's $17 billion of U.S. money goes to letting people on the food stamp program buy Coca-Cola. They should be buying distilled water, filtered water, high pH water, and a rotisserie chicken. That's what should be on the plan. And it should be a grass-fed chicken from a local farmer. That was, eggs. I mean, regenerative farming. Somehow we've got to get back to that. That is so important. That will solve most of our dental issues, including facial development, which leads to comorbidities later, like sleep apnea, heart disease, cancer, all these things. I mean, it's amazing. And the movement is beginning, and I think a lot of it is because of the internet and because of people like Mark Hyman who are willing to go way down the chain, look for root cause. Talk about one root cause that he has kind of glommed onto. It's fantastic. So what you read about for overall health, it's all connected to oral health as well. It's all the same thing. And so I don't know if that answered your question about carbohydrates, but be wary. A good carbohydrate is like a sweet potato fries in olive oil. Cut them up, cube them, put a little Celtic salt on there. I soak them in water first and then let them dry. And then I put them in the oven, at 400 degrees for, depends on the oven, 15, 20 minutes. Then I take them out, let them cool. And then I put them in again. They taste just like French fries, even better. And everything is good for you on that plate. I mean, it's fantastic.
Yeah.
Going to McDonald's and buying a deep fried French fry. I mean, the potato's wrong.
Oil.
Oils, the temperature. I mean, it's frightening.
Yeah. Well, I was actually just researching this last week the healthiest countries in the world, and just because of the whole coronavirus thing, right? So I was looking at Italy. So Italy has one of the oldest populations, and they are getting hit hard with it. But they're also in the top 10 healthiest countries in the world. We're number 35. And there's more than just the elderly at risk. There's people with other things, with diabetes, with blood pressure issues. All those people are higher at risk. And we have way more of that here than they do in Italy. And while I was researching this, Australia is also in the top 10. And there's actually, I wish I could find the site right now, but you can see like a bag of Cheetos in Australia and a bag of Cheetos here. And the list of ingredients in Australia and the list of ingredients here, and the list of ingredients here is 3 times as long and has way more things. Yeah, because these other countries ban these things that are so harmful for you. Yeah. And it's like, how are we so far behind? We're supposed to be the most amazing country in the world. Like, how are we so far behind in literally giving people harmful substances for their body?
Yes.
How is that even
neurodevelopment and the think tanks and the wealth of our country is how smart we are and how compassionate we are. And I will argue that has been lacking in recent decades. And you wonder, where is it coming from?
Mm-hmm. Yeah. So I just want to ask too, is it possible to reverse cavities?
Absolutely.
Yay.
You say that with some trepidation. I mean, everyone does.
Well,
there's
the book, I think it's called Reversing Tooth Decay.
Right.
Yeah. My sister read it and she actually reversed some cavities, and I was telling a dentist about it and she did not believe me at all.
Right. Yeah. So we reverse cavities. They have to be small. They have to be in a certain area. Yeah. They have to be monitored. It's a big sacrifice on the patient's part sometimes because you have to modify your diet. I stopped getting cavities when I gave up carbs. It's simple. It is very straightforward. It is, I know.
He's laughing at my face when he says giving up carbs.
Speech related. I tape my mouth at night now so I don't have a dry mouth at night. I mean, all these things, we know what it takes to reverse a cavity and, more importantly, prevent a cavity. In fact, we have a cavity guide. It's Dr. B's cavity guide on how to reverse cavities, prevent getting them. It's for kids. It's for adults, for parents. We have that on our website. I'll send you the link so you can include that. It works. People in 6 months, these are people I don't know. These are patients that are seeing another dentist, and they have to find a dentist that's willing to play along, of course. And there are some, of course. But the conventional wisdom now is that you can prevent cavities 100%, and you can reverse small cavities. Now, a big cavity, of course, once it's past the enamel is the part that can rebuild itself. Let me put it this way. Right now in your mouth, and even in my mouth, considering I eat less carbs than you do, there is a state of equilibrium where there's a cavity forming and there's a cavity being reversed. And if you overcome the system and you demineralize quicker than you remineralize, i.e. dry mouth, change in pH, higher acids, poor diet, feeding the acid attacks, and the dysbiosis of the oral microbiome, maybe some genetics, maybe poor biofilm management. Those are the 4 items issues that are involved with cavities. Then you're going to get a cavity. So it's not this switch that flips and you've got a cavity. I think most of us, and when I was a young man, as a young dentist, I just thought cavities were something that most people get. And it is the most common disease in the world. It is. Now I see it completely different. There's no reason why anyone should get a cavity. It is not the default condition when it comes to having teeth in your mouth and eating and living for 80 to 100 years. There's no reason why you should get a cavity. Yeah.
Does oil pulling help with that?
Oil pulling can help. I think, coconut oil is an emulsifier. It does have an effect on the biofilm. There's nothing wrong with biofilm or plaque or the pellicle. That's the older term. The skin of your teeth. That's the oldest term. Biofilm is there for a reason. When the tooth erupts, it has a biofilm on it. There's a reason for that. That's a biofilm is a bunch of bugs that are trying to protect themselves. Now, these are the good bugs that are trying to remineralize and protect your tooth surface. Now, that biofilm can turn bad if certain bugs become dominant. And that's, the dysbiotic oral microbiome. So biofilm's not bad. Of course, we've been brainwashed to remove it and to scrub it off and to never have it come back. And obviously, it grows back. When you come in to see the dentist and we use that little polishing cup with fluoride paste or non-fluoride paste, which would be pumice, we're polishing off your pellicle. Well, it's back in a few hours. It grows like a weed, and it's there for a reason. So that's why I call it biofilm management. You want to manage the biofilm and make sure it is the right thickness and right composition so that it is helping protect your tooth.
Mm-hmm. That's interesting.
So oil pulling has an emulsifying effect if you have a very thick, fuzzy, dysbiotic, carb-fed, aciduria, acidophilic kind of environment where the biofilm is out of control. And I call that furry teeth. I mean, for my patients, especially my young patients, and they get it. They can feel the difference, between that and a very smooth feeling with their tongue. If that's the case, then oil pulling will break that down. But you can overpull too much. Coconut oil can remove a lot of the biofilm. So I think I would say, 5 minutes with a good quality coconut oil. I wouldn't use sesame soda oil. I like olive oil. Olive oil is amazing. You can't go wrong with olive oil. It's good in every regard. It's got such a great track record, except for, adding antifreeze. There was that scandal where some of the Italians were adding additives to bolster their, that's besides the point. Right? Just get, extra virgin, olive oil and use that. People use it on their skin. They use it in their hair. I'm not recommending that, but it's great for oil pulling. But oil pulling has a place. Just don't overdo it. And obviously don't swallow the oil because you are pulling toxins off of your biofilm.
Yeah. That's so interesting. I forgot to ask you one question about kids because I saw it on your Instagram. You were saying that you're not a fan of Sippy Cups.
I am not.
And I would love to just kind of hear why.
Yeah, it can alter your facial development. It's the motion of drinking from it, that pursing of the lips. Depends on how long you do it. For a short period of time, maybe. But there are lots of alternatives. There are these little silicone cups that are weighted on the bottom. They're very bottom heavy. You fill them up halfway. The kid can put them down and pick them up without spilling. They're shaped in such a way that when they put their lips to the rim, that the lips are properly positioned. They get the tongue action of pulling the liquid down their throat. Doing this from a straw or from a little nipple, a nipple that doesn't deform and go in the mouth and develop the palate and the shape of the width of the tuberosities, the upper jaw. That's crazy stuff. It will alter the proper development and formation of your child's face. And I'm not talking about aesthetics. I'm talking about function, being able to swallow properly, being able to breathe through their nose and sleep properly when they're an adult or even as a child. So sippy cups are not good. Pull the carpets up. Don't use a lot of sticky juices. And my granddaughter adapted very, very well. There was a short sippy cup period of time, but she eats solid foods. Chewing is important. Yes, it's going to be a mess, maybe, but I think parents don't hang in there long enough. They see that one spill and they're done. Also, pacifiers. Pacifiers, they have orthodontic pacifiers. That is so misleading. Maybe it's not misleading. They will cause your child to have the need for orthodontics later. So maybe that's truth in advertising in that sense. So,
yeah. So just sleeping really quick, you've brought that up several times. I know for myself when a while ago, being pregnant has definitely made me more congested.
Yes.
And when I sleep with my mouth open, I can't sleep. It wakes me up all night. It drives me crazy. I actually just bought a humidifier because I just feel like it's dry in my room and maybe that's why I'm congested. I started putting coconut oil up my nose for some reason, to like keep it moist. Cause for some reason that helps me be able to breathe. I'm just like trying everything I can. But you've talked about sleep tape. And if somebody hears like you tape your mouth shut, it kind of sounds a little crazy. So I'd love for you to just touch on that.
Right. I mean, that was my first reaction 10 years ago when I came across it. So let's take your case. For example, if you were a patient, I would ask you, do you have any allergies? You definitely want to be able to breathe through your mouth, whether you're pregnant or not. It's dry. Then I would recommend a product called X-Clear. Again, it's on our affiliate store. It's a grapeseed extract with xylitol. It's a nose spray. Whenever I have a very dry nose, I use that. It's not a decongestant, which typically those have a rebound effect. They'll work for a few hours, but then it gets worse, and that'll happen around 3 a.m., and then all of a sudden you're congested. But when you say that when you breathe through your mouth, you tend to toss and turn more, that tells me that you probably have a slight constriction of your airway. And when the mouth is open, because of the volume air that's coming through for breath, and also the dryness of your throat, that when it does collapse or narrow, it's less likely to release. And so you're probably getting something. It's probably an upper airway resistance syndrome where you are waking up more. And again, it's not fully awake. It's just it's coming out of deep sleep because your body thinks it's suffocating. So and you may be a perfect candidate for mouth taping, because if you can just redirect the air through your nose, because the air comes in at a more gradual pace, it's baffled, has to go past all these baffles in the nose, it's humidified, it has a different temperature and humidity level when it hits the lungs. There's no dryness of the airway that can stick closed or when it touches. A lot of people benefit greatly from mouth taping, and it freaks them out, of course, because they think they're going to die. And trust me, your body won't let you die. You'll be ripping that. If you can't breathe through your nose, and that you'll get hypoxia, you'll get a headache. If it's really severe, you'll rip it off. You'll wake up.
Right, you're not duct taping your mouth shut.
No. You want to use special mouth tape, and literally the tape is just a reminder. You're not wiring your teeth shut. There's special tapes, and again, we have it in our affiliate store, that if you were to, even with a child, if you were to open just a little bit of a struggle, not even a struggle, I don't even want to use that term, just by forcing your lips open, the tape will peel off. Mm-hmm. But if you can sleep all night and when you wake up and the tape is on, you have redirected that air through your nose rather than through your mouth. And I can tell you, because I test my sleep every night, if I can't, for some reason, wear mouth tape if I'm congested, and I try and push through that. Even if I'm congested, I'll lie down, bring my heart rate down, bring my respiratory rate down, and try and tape and get the airway open, the nasal passages. And that works 99% of the time. But there were a few times over the winter when we were up at our ski place, and for some reason I'm more congested up there. I also get bloody noses occasionally. The air is very dry. We have carpets in our bedroom, unfortunately. That's the nights that I don't mouth tape. My respiratory rate is higher. My resting heart rate is higher by a little bit, but it's measurable. And my sleep is less serene or amnesic. In other words, I have more memory. I may go to the bathroom more in the middle of the night once than I would if I had taped, where I wouldn't go at all. Those are all signs that you are having apneas. And so the mouth tape does make a big difference. It is measurable. Even your HRV, heart rate variability, will go down. And the amount of time that you move around or how you feel the next morning. So most people benefit from mouth taping, but if you have full-on sleep apnea, it's not a cure for that. I mean, I would just say a lot of young people, maybe after age 5, some say age 3, experiment with mouth taping. You can tape It's a reminder to keep the lips closed. You'll get fewer cavities if your mouth doesn't dry out at night. You'll have less chance of gum disease. I mean, there are a lot of oral implications of mouth breathing. So I would try it and see. Pregnant women tend to be slightly more restless, but I have a feeling, and I would love it if you get back to me, if you mouth tape, your sleep will improve.
Yeah, no, I'm definitely open to trying it, because I feel like I normally don't sleep with my mouth open. It's literally it's usually just if I'm congested. And so I've been actively trying to, like you were saying, just kind of clearing my nose and actively just breathing through my nose until I fall asleep. And then I'll kind of wake up and I'm breathing through my mouth and it just feels dry and it's uncomfortable. And I hate falling asleep. Like if I have to breathe through my mouth to fall asleep, it's very hard for me to fall asleep. So, I'm definitely open.
Another thing I say to patients, especially the elderly, but it applies to everyone, is if you are getting congested, you tend to get more congested as you lie down. So it's a blood pressure thing. But I would keep your head elevated. Get one of those wedge-shaped pillows and try that. And a lot of people do well that way in terms of releasing the congestion. And trust me, if you can't breathe through your nose, your sleep is affected in so many ways. For example, your O2, CO2 concentration, the pH of your blood, all those things are affected. Nitric oxide release, which is good at releasing the tone of your blood vessels, which helps you relax, and that sympathetic tone versus the parasympathetic tone. Nose breathing is key in so many different ways.
And as you kind of mentioned earlier, with kids, a lot of parents are unaware of their kids' sleeping issues, which actually leads to a lot of behavioral issues and other things as well. So the sleep taping could be beneficial there.
Absolutely. I mean, and I always tell parents, you better know how your kid is sleeping. I tell them, put them to bed at 8, and before you go to bed at 10 or 10:30 or 11, go in there, maybe with your Kindle or something that's not too bright, and sit up with your back up against the bed. You don't have to see them. You just have to listen to them. And if you see a lot of movement and a lot of snoring and a lot of snorting through their mouth, and they're not breathing through their nose, and they're not sleeping like angels, go see your dentist, someone who is an expert in sleep disorder breathing, or a pediatric ear, nose, and throat that also specializes in children in terms of their sleep disorder breathing issues. It will make a huge difference in terms of all their choices, risk management. Risky behaviors, what they choose to eat, mood, how nice they are to their siblings, how they do at school. It all starts very, very early on. It has a lot to do with being able to breathe through your nose. It is, and sleep.
Yeah.
Also, always observe the position of your child. If they're on their back or slightly on their side and they're not moving, but if they're spinning in bed or on their knees and elbows or sleeping on their stomach, those are all signs that their body subconsciously is looking for a position where they can just keep that airway open.
That's so interesting. I feel like we touched on so many different things today. So for those of you listening, definitely dive into some of the topics that we brought up. There's tons more stuff on Dr. Mark's website, and he follow Ask the Dentist on Instagram. And then is your page just askthedentist.com? Yes. Awesome. And I'll have all of that up with the episode so that you guys can find out more about him. He's fun to follow just because there's the other day I learned about the cups, the tiny cups that you were just talking about. And I actually added those to my baby registry because I'm looking for things I need, don't need, and I'm like, oh, I'll put that on there. I'll try that out, so.
I love those little tumblers, I call them. They're great.
Yeah. So it's just nice to get little tips and research and stuff like that. So thank you so much for being here and just answering all of the questions that I had. And I feel like we went over so many different things. So just thank you so much for taking the time to come on the podcast.
It was a pleasure, Liz. Thanks for having me on the podcast.
I had so much fun talking to Dr. Mark. There's so many other questions I feel like I have for him that I want to talk to him about. But again, like I said before, follow his Instagram page. And just to update you guys, so we did this interview about a month ago, and I have not tried mouth taping yet. And I actually do. So I've been sleeping better. I sleep with my mouth shut now because of my humidifier has helped a lot. And then I was trying to explain to Vito the mouth taping thing, and he's so freaked out that he doesn't want to try it, but he will fall asleep. And if he's exhausted, his mouth will be open. So I'm going to, I would still love for him to try it and see if it makes a difference at all. But it was super interesting and fun to talk to him. If you guys are listening, but you have not hit the subscription button, make sure that you subscribe and can follow along wherever you're at. Join our Facebook group, Miraculous Mamas, and the Instagram and Twitter page, where I always post information about the guests and just different pregnancy tips and things like that. I also just announced this last week that I'm going to be diving into on the podcast, like little like parts of birth planning. So I'm going to start doing, I don't know if it'll be this month or next month, just like little segments about things on your birth plan. So why delayed cord clamping is so good, different laboring positions and techniques, ways to prevent tearing, why skin on skin is amazing, and just different options for birth plans. But I'm going to be bringing on a few different people to highlight and to talk about it, not just birth plan, but also planning postpartum, because I feel like we don't do that a lot. So some breastfeeding advice, and then I'm going to have somebody come on and talk about cloth diapering, because that's what our plan is. So let me know what you guys want to hear, or if there's anyone specifically that you want to hear from, and I will see if I can get them on. But they're just going to be like little segments added onto the episodes. So you guys can just kind of get little tidbits here and there if you're building your own birth plan or planning one in the future, or even just being like, oh yeah, I did that, and looking back and just learning our options together and growing together, which I love. So thank you so much for your time. I know how valuable it is, and I'm super excited for you guys to be along for the journey next week. I got to look at the calendar real quick, because next week is Father's Day. Yes, I think. Yes. No. Guys, how come I don't know the dates? Father's Day is not till June 21st. Okay, I was way off. I was thinking Father's Day was next week. I told you that this pregnancy brain thing is the thing. I had in my mind that Father's Day was June 11th, which is apparently a Thursday. So that's not right. But you know what? Whatever. So Father's Day is the 21st. And yeah, we have some super exciting guests, and I'm really excited for you guys to be along this journey with me. Love you so much. Talk to you next week.